Good morning, everybody. Today I'm going to be speaking about breaking the pattern of chronic anxiety, some transformative treatment strategies for you today. We're going to speak about behavioral treatment strategies, and also we'll speak a bit about medication management of chronic anxiety disorders also. I was attending a gala at our local New Orleans Museum of Art, and it was a typical fundraiser for museums. They're always in need of some money, so I'm a strong proponent of that. And so, I walked in the front door, began looking at some of the exhibits, and then decided that I wanted to move on up to the second and third floors. So, I found an elevator toward the back of the room, and I got in, and four of the ladies got in with me. So, we get in, the door closes, and then the elevator is not moving. So we waited for about 30 seconds or so, and the elevator is still not moving. I was toward the front of the elevator, and I touched the button a couple of times, and so it just appeared to be classically stuck. I guess that's the word that I would use here. So another 10, 15 seconds went by, and I started hearing some gasping toward the back corner of the elevator. And it was this shallow breathing. It started to get a little bit deeper and deeper. And a woman evidently was having a panic attack. At least that's what I thought it was. Now, I have no confirmation that it was a panic attack. I did after another minute or so, but obviously she was uncomfortable. So she had three other lady friends around her, and here's what they did. They said, don't panic, and take a deep breath, take a deep breath. Well, she was trying to take a deep breath, but her breaths were so shallow that she literally couldn't get enough air in her lungs. So I'm not saying a word. I'm just standing up at the front, and I'm just waiting for a moment just to see what's going to happen. So, and then somebody jumps up and says, well, let's give her some air. Let's give her some air. It's always interesting to me that when someone has fallen down, that one of the first cries to go up is, let's give them some air, as if all of the air has disappeared right around them, which of course it hasn't. So she's making her way, I should say, into a full-blown panic attack. She's starting to sweat. She said, my heart seems to be racing a little bit. Her pulse rate and also her blood pressure may have been up just a little bit, but not all that much. And then she said, I just feel like I'm going to faint. So what they wanted to do was just lower her down to the ground and just sort of let her sit in a crouched position. And that's when I jumped in and said, please don't do that. Because if she gets down too low, there's a possibility that she has something known as postural hypotension. And that means if she gets up, she'll really get lightheaded, and then we've got a mess on our hands. So I said, no, just hold her up, just prop her up. It's going to pass. They didn't hear the it's going to pass part, because she's in an active panic attack. So I presumed that my job was to get us out of the elevator. No one assigned that job to me, but I just took it upon myself to do so. And it was as hard as opening up the emergency box, taking the phone out, and saying, we're stuck in elevator number 1 toward the back of the building. So I said, okay, all right, we'll have you out in 2 minutes. So some of the attendants came around, and whatever it is that they did, the door opened, and we were able to exit. At that point, she was still panicking a bit, but the symptoms were starting to abate. So we walked out, and she stopped me, and she said, do you know anything about panic attacks? And I said, well, a little bit, yeah. She says, well, I was having one in there, and I felt like I was going to die. And I said, no, you weren't going to die. Have you had panic attacks in the past? And she said, I have. And I said, would you like to rid yourself of them? And she said, yeah, I would, but I don't really know what to do. You're supposed to take deep breaths, right? I said, no, don't ever take a deep breath. Really what you to want to do is breathe like a baby. Take these small, shallow breaths. And I'm going to speak about that on an upcoming slide in just a few moments. She said, I really felt like I was going to die, sir. I said, you aren't going to die. No tombstone in America reads death by panic. Never seen that, and I doubt that I ever will. So she said, well, gee, thanks. Did you get us out? I said, well, how did you do that? How did you do that? I said, all I did was pick up the phone. And they came around, and about 2 minutes or so, we were out. So So we're walking around a little bit more, and then I happen to run into her up on the 3rd floor. And she says, well, tell me what it is that I would need to do if I don't want to have another panic attack. I said, well, the first thing you want to do is to plan to have another panic attack, and to have a panic attack after that, and a panic attack after that, until your brain finally recognizes that you're not in danger. When you're having a panic attack, what's happening is you tend to feel uncomfortable. You feel a sense of discomfort, but you're literally not in any danger. Well, I thought I was going to faint. No, you weren't going to faint. People think that their blood pressure drops when they're having a panic attack. Blood pressure does not drop. Instead, it rises a little bit. Well, tell me what to do. I said, well, next time you walk into an elevator, walk in, stand comfortably, and if you start to feel symptoms of panic coming on, just let them come on, knowing that they will pass. Do it again, and do it again with another elevator, and eventually your brain is going to recognize that when you walk in an elevator, you're literally not in danger. Is that all I have to do? What about medication? No medication. You want your brain to rewire itself, particularly the amygdala area of your brain. Well, what's that? I said, well, that's the danger control center in the brain. So that's what you want to do. It's a transformative practice. So it was interesting. I gave her a card. She says, well, you seem to know, do you do this kind of work? I said, yeah, I do it. Do you help people? I said, sometimes. Sometimes I help people. Well, what do you mean sometimes? I said, well, some people can't be helped. What do you mean by that? I said, well, they'll come in and we'll talk about the problem, and then I'll assign some exercises, and then they won't do the homework exercises and nothing really gets better. So if you want to be helped, here's my card, give me a call.